Well, thank you again for the opportunity to present the work of the Academy. This is the work of our number of volunteers, our committees, and our staff working together, and it gives you an oversight of what's been the focus of the last 12 months and will be the focus going forward. We're running a little short on time, so I don't intend to go through everything in these slides. They'll be available for distribution afterwards on the website, as well as myself and others will be available after this meeting if there's any questions. Last year, we talked about the Academy's commitment to our members, that our value proposition that we were focused on, which was to really kind of 4 specific areas that we really wanted to provide our members the resources for the mandates that they were facing in the new healthcare system, that we really wanted to work to help provide our members with advanced clinical education so they could advance the skills that were going to give them new opportunities and advance their career in the new environment. Also help lead them through the transitions that are going on in the business environment and advocate strongly for the specialty and our patients. And these continue to be our focus through this year, next year, and ongoing. We laid out our strategy last year of how we were going about this also, that we were working on our unity initiatives within the specialty to strengthen the voice of the specialty as one voice, and that's what you see continued this year with physiatry is more than in other activities. We are working to create a vision for the specialty. Then Dr. Geringer has gone over that in detail, really, and moving from visioning PM&R bold, advancing PM&R bold, and then really working on the Academy's strategic plan for how we could dedicate the Academy's focus and activities to advancing that vision. So let's give an update of what that really means, and just some high level. This isn't nearly comprehensive of what the Academy's done over the year, but some high level activities that the Academy committees and volunteers and staff have been focused on. So starting with the advocacy areas of policy, health policy, practice, reimbursement, quality, and research. To say it's been a chaotic year in the legislative world, we all know the uncertainties in healthcare that seem to change day to day. Well, that's really had us on our feet in terms of responding to all sorts of different wind changes in DC. So the activities working from our Academy-defined healthcare reform principles, we've been very active, both face-to-face on the Hill, as well as really submitting lots of letters to Congress and all sorts of pending legislation on healthcare reform activities. In June, we participated in a congressional briefing really to educate members, legislative members, and staff on the Hill, as well as doing Hill visit afterwards, to really have the value of rehabilitation and habilitation services. We continue to participate in lots of coalitions on regulatory relief and Medicaid issues, and we formed a subcommittee of the Health Policy Group this year to focus really on state activities and in a way to really have a rapid response team on state legislative activities that were impacting the specialty. In physician reimbursement advocacy, we submitted comments, proposed rule comments on skilled nursing facilities, inpatient rehab facilities, as well as the physician fee schedule. And in doing this, we've expanded to not only work with a wonderful group of volunteers and other market research information we bring in, but we've started to really reach out more to members using virtual town halls and different things for our members at large to really give input, greater input into the advocacy positions of the Academy. We also remember that advocacy is not only what we get included in different activities, but also what we prohibit. And we were successful in petitioning the national, as one example, the National Correct Coding Initiative not to pursue with a plan that would have prohibited billing of trigger point injections with certain imaging codes. So sometimes it's what we get included, and other times it's what we're able to stop moving forward in our advocacy world. Also in physician, when we talk about reimbursement, we put a lot of effort into member education, running monthly coding Q&As in the Connection publication, in-depth articles in the newsletter, increased number of webinars on coding issues, and we also have completed a comprehensive member compensation survey that will be available later this year to members. As we did last year, the focus on MACRA continues to be a real significant effort for us, helping our members really understand what MACRA means to them and what they need to do, what's their best path for avoiding the penalties of MACRA. This included other educational activities like webinars, but we also submitted and collected from members information to submit our comments to CMS when they were looking for ways to improve the quality payment program activities. We also continue to work on alternative payment models, which we know is one of the steps that will also evolve out of the bold models that we're looking at. Our efforts with the spine registry continue in our partnership with the American Association of Neurological Surgeons. The spine registry this year received QCDR status, that complies with MACRA, and the American Board also approved it, participation in the registry as a means for satisfying Part 4 of MOC. That effort continues on as we'll sign up more folks. We know that another concern within the specialty has been the lack of quality measures that we feel successfully define your practice and what you do and the value you have. And for years of working with organizations like the National Quality Forum and others, we finally have stepped out and said we need to create our own measures. And the board approved significant funds. When you look at Dr. Gittler's Treasury report, significant funds that are going into creating quality measurement sets that are applicable for really physiatric-centric. We started with this year working on 5. You can see there was a focus on stroke, muscle spasticity, functional assessment, and family training. These are through a contract with the Physician Consortium for Performance Improvement, where we work with all sorts of other medical specialties in a collective group to advance these measures. The Academy is sponsoring these with hopes that they will be used in future platforms for our next stage of registries, as well as being available in 2018 for the Quality Payment Program. One of the other major activities of the Academy is representing the specialty in all sorts of national organizations. We continue with the traditional ones at the AMA and the sorts with the RUC and the CPT committees. But with the quality movement, we're also, our members with Academy support are out there in over 20 different clinical and technical expert work panels, really working with all sorts of activities to develop quality measures and guidelines. Highlighted there is one of the activities that we partner with the foundation to participate and represent PM&R as it relates to creating guidelines for cancer survivors, exercise guidelines for cancer survivors. This is just a snapshot of all the, not all, but a great deal of the different organizations that we're involved in. I would just throw this up there as a reminder. This is only done through the support of our members. This is where your dues are also going to help PM&R voice in all these different national organizations that we're involved in carrying the PM&R flag. So looking ahead, what's our priorities in these areas in 2018? The board approved getting involved with the American Society of Anesthesia's Perioperative Surgical Home Steering Committee. What this is when you look at our bold vision, when we talk about wanting to get more upstream, further into acute care, this is an opportunity for us to work on that goal with a learning collaborative that ASA has developed. We're also going to participate in Blue Cross Blue Shield Evidence Street program, and we have entered into a partnership with the National Health Council, which is a group of patient advocacy organizations, so we can really not only support their message, but combine our message and their message as we go to the Hill, which we think is a very strong tool when we're dealing with advocacy. The board has asked the committees to relook at our positions on to help with the opioid epidemic issues, our position statement, and we are going to join the National Quality Foundation's opioid stewardship effort. They'll be going forward. We'll continue to work with the Spine Registry and continue our focus on MACRA education. Looking quickly at education and member services, this is a real quick snapshot at this year's annual assembly. These were the numbers as of this morning, about 3,300 total attendees. That included about 2,600 physiatrists or other medical professionals. 642 of those were residents. I'll also tell you that an increasing trajectory that we're seeing is in medical students, those that are really dedicated, focused on the specialty. We had over 300 medical students with us this week. 5 pre-courses, 174 sessions. You can see all the abstracts that our committees worked through to develop the program, and we knew this year we had a late-breaking abstract process. We continue to always innovate the meeting, and there was really significant changes in this year's meeting. Some of them went great, some of them we learned from, and we keep tweaking and look at next year. Hopefully a number of you went up and saw the Learning Center that we put into the pavilion. That was all new this year, bringing education in, which was free, hands-on, and other didactic education for our members. That was a great success. We went away from the tracked system and really went into 12 sessions. We worked to try to right-size those in rooms instead of having large rooms like this when we're only going to have 100 people. We got a lot of complaints about that in past years. We have some additional tweaking to do there. I think out of about 170 sessions I will acknowledge we have about 5 or 10 where the room size estimations weren't good, and we need to work on that in coming years. We have a new format skills lab that went forward this year. We had a GME Leaders Summit, extended the pavilion hours, and we really had a focus on education for the residents and early career programs. We had to cancel a couple programs, also add because of the different disasters, faculty that were from Houston, from different areas that we weren't able to move forward. So it was a year that we had to work on our feet and be flexible. We had 5 pre-courses on Tuesday and Wednesday preceding the conference. And today there's the formal medical student program. 200 of those 300 medical students are actively engaged as we speak in a medical student program with our volunteers helping to introduce them to PM&R. We continue to be dedicated to providing the resources and tools for our members to satisfy their MOC requirements. As a reminder that we have our SAEP products that are available for to satisfy MOC Part 2. All our members, as of last year, get 1 a year, which is what you need to satisfy MOC, free with your membership. And we made our Part 4 performance improvement products free to all members, and they also include 20 hours of CME with them. Right now in our portfolio, we have 10 SAE products. I said 1 is free. We have a number of resources that are available to prepare it for the MOC 3 activities, and as mentioned, our MOC 4 activities now include the 4 PIPs that we have available, but the approval of the spine registry activity to satisfy for Part 4. One of the new exciting programs that's just started is the introduction of a new skills training evaluation performance program, STEP program. This has been initiated with initial focus at looking at the musculoskeletal and neurologic ultrasound skills, but we imagine this is something, and we've already heard from in a lot of meetings this week, of opportunities where folks really think we should expand this into other areas, where our members are needing certificates. And this isn't a certification, but certificates to show their skill level in their training and assessment for privileging, for reimbursement, and for other activities. This will carry forward in 2018. Our Academy Me education catalog was expanded in a number of ways. We took the Cancer Rehab Summit activities from last year. Those are out there, and a number of new SAEP products are available. We continue our partnership with Mayo on the Sports Medicine Board Review course, as well as our partnership with AMSSM, and this year that was expanded to give our members access to 35 sports ultrasound online didactic videos that also include CME with them. Career Services continues to expand here at the Assembly. We had a Career Services Corner that got a lot of activities on the exhibit floor. Wednesday night we had a job fair that had over 100 employers and 700 attendees. So looking forward in 2018, one of the new programs that you'll see rolled out is what we call Innovators and Influencers, and this is really an extension of our advancing PM&R vision. This is really a program that we intend to spotlight and highlight those of you that are really pushing the specialty forward in innovative ways. It will also be the umbrella by which we develop more leadership development programs, as well as when we bring leaders together to kind of tackle all the critical issues and controversial issues facing the specialty. We have some new incentives to help keep our young graduating residents in early careers in the Academy. They'll be rolling out this year that lowers their dues in their initial years, as well as incentivizes them to maintain their membership with a free annual assembly if they maintain their membership in the Academy. Next year, we also have the compensation survey that will come out when you pay your dues this year. We'll receive a free compensation survey, and we look forward to the annual assembly next year in Orlando with a focus on innovation and practice, science, and leadership. And we had to figure out how to top last night's President's reception, and we think we have it with an event at renting out Harry Potter at theme park at Universal Studios. So look forward to that next year. We have a number of new MOC products coming out next year, and just wrap up, we couldn't do any of this without the 600 volunteers that work with our team, a terrific board of governors that's very dedicated with their time, and I have a wonderful staff back and partners back at the national office that make this all happen. Thank you.